Myself, Dr. Anand Pandey. First of all, I'd like to give introduction on myself. Uh, I have completed my MBBS, then MS from General Surgery. I have completed my MBBS from Rohilkhand Medical College, Bareilly. Then I pursued for the MS General Surgery from Pramukh Swami Medical College, that is in Karamsad, Anand. I have completed my GR from there, after which I was given as an opportunity for working there as a SR, that is senior resident. Uh, After completing my senior residency, I was promoted as an assistant professor in Department of General Surgery at PSMC Karamsad Anand. After working few months over there, I switched over to some other medical colleges, and finally, right now I'm in ASMC Gonda, working as an assistant professor. I like to share few do's and don'ts of hepatitis. But before doing that, I'd like to brief you on the hepatitis. What is hepatitis? It is the inflammation of liver. And what is inflammation? It is the swelling of any body tissue or the swelling of any body tissue. Then the etiological factor of this hepatitis. Hepatitis are caused by various kinds of non-infectious agents and majority by the viruses that are hepatitis A, B, C, D, and E. Majority among these five kind of hepatitis, 90% of the causative factor are by either hepatitis B or hepatitis C. According to WHO report, approx 4.5 billion premature deaths could be prevented by creating awareness or diagnostic tools or with the proper medications against the hepatitis. Now I'd like to brief on the various types of hepatitis, that is hepatitis A, B, C, D, and E, and what are the causative factors, what are the general symptoms, and how we can prevent them. To start with hepatitis A, it is generally caused by the fecal-oral route by the viruses whenever we come in close proximity with the infected persons. And the symptoms are fatigue, weakness, generalized symptoms, and it could be prevented by proper hygiene. Okay. It is generally caused by either sexually transmitted from person to person or any way of blood contamination like blood transfusion or syringe, using a syringe from an infected person to a normal healthy person. The symptoms are again like that of hepatitis A: fatigue, generalized weakness, pain, and we can prevent it with, by the vaccination. Now the hepatitis C. Hepatitis C are almost similar apart from sexually transmitted. This hepatitis C generally caused by blood transmission, either by the blood transfusion or by the syringe contamination from an infected person to a normal person. But the thing is that in hepatitis B, the patient has the symptoms, but in hepatitis C, patient don't have any kind of symptoms. And the prevention mode or the treatment part is both. Either for the hepatitis B or C is the vaccination. Now we'll be talking about hepatitis D and hepatitis E. Hepatitis E is generally caused by the water contamination whenever the through the virus by the infected water. The illnesses, the symptoms are again like that of hepatitis A and B, that are generalized weakness, fatigue, irritability, pain. But there is no any particular treatment for the hepatitis E. And about hepatitis D, the symptoms are very severe. It can lead to a permanent liver damage and death. And the prevention part is, again, if we are immunized with or vaccinated with hepatitis B, then it also provides immunity for the hepatitis D. Now, in the last but not the least, what are the few do's and don'ts of hepatitis? Do's are: take sufficient rest and eat a well-balanced diet as per the doctor advice. Drink 6 to 8 glasses of water a day. Avoid tobacco and drugs. Wash hands with soap and water going to the toilet. Cover open wound, sore cuts with a bandage. Discard used item carefully to prevent any accidental exposures. Get vaccinated. Get tested for the hepatitis during the pregnancy, and practice safety Practice safety hygiene to avoid sexual transmission. Hepatitis, don't use any personal items of an infected person. Don't share razors, toothbrushes, syringes or the needles. Don't donate blood or breastfeed your baby if you are infected with hepatitis virus. Don't drink alcohol. Avoid traveling in infected conditions and also avoid poor sanitation area. Don't take acetaminophen or any other the-counter drugs without your doctor's prescriptions, and don't eat or drink contaminated food or water.